Welcome back to ultrasound imaging. This is lesson 3. We're going to talk about the color Doppler function, and this is another basic function that we can use to actually get some diagnostic information. You may or may not use this very often, but it can be a great tool. The color Doppler function is used to show the direction of blood flow, not the type of blood, as in arterial versus venous. Always be aware of the fact that the transducer is located at the top of the image. And the most important thing to remember is the BART acronym. Blue represents flow away from the transducer, and red is flow toward the transducer. Here's an image showing color flow. This is actually called a 5-chamber view because it includes the aorta. The blue flow in the left ventricle is traveling away from the transducer and toward the aorta. The red flow from the pulmonary veins in left atrium is moving toward the left ventricle through the mitral valve. This denotes normal cardiac blood flow. Here's another image using color. This is the left atrium and left pulmonary veins. And we'll get to identifying anatomy in the next module. Red flow is showing blood flow from the pulmonary veins into the left atrium, which is normal. The sample volume shows what area is being used for the color. This wedge can be size adjusted and repositioned anywhere on the screen. And our old friends GE and Siemens are here. Zooming in, we can see there are different ways to denote the color Doppler function. GE consoles are actually labeled as CFM, or color flow mode. For Siemens, they simply use the letter C. Press these buttons to activate color mode. Use Set and the trackball to change the size of the sample volume, and press the Set button again to lock that size in. Use the trackball to move the wedge over the area of interest. To go back to regular imaging, simply press CFM or C again. Give this mode a try the next time you have a procedure with ultrasound. The more you use it, the easier it gets. In conclusion, color Doppler shows us the direction of blood flow only, not the type of blood. Use the acronym BART to keep the blood movement clear in your mind.